So hi, thank you for that warm introduction. My name is Patricia Silva, and I completed my practicum in partnership with the Public Health Agency of Canada and the Northern Health Authority in BC. And I mean, as you can see from the title, we're talking about food allergies in the school environment. All right, so before we get started, I just want to acknowledge with gratitude that my work has taken place on the unceded territory of the Algonquin and Anishinaabe people, where I reside here in Ontario. However, I recognize that the work from this project will be carried out on the unceded, ancestral, and continually occupied territories of multiple First Nations across northern BC. So how did this project come to be? So the goal of my project was really to look at the literature for the evidence and also engage in partner consultation to provide recommendations for the redevelopment of Northern Health's allergy resource for schools. So Northern Health currently has a 3 to 4 page document. You can check it out using the QR code. And it's pretty comprehensive. It talks about food allergies in school. But over the year, the team has received a lot of questions and participated in conversations about just trying to understand more about this topic at a deeper level. So that's where my project came in. I know I'm the presenter, but I also want to put your knowledge to the test. So we'll just do a quick true or false. You can type in the chat or just unmute, it's okay. So true or false, up to 8% of children are affected by food allergies. So if you're reflecting on that and you said true, you can come do this presentation. I'm just joking, but that's correct. So Food Allergy Canada states that in Canada, over 600,000 children under the age of 18 years old have a food allergy. And peanuts account for about 2% of children overall. And peanuts and nuts are about 4% of children. So that's about half of children with food allergies, if you're following that. So before we get started, it's really important that I kind of wanted to highlight 2 common approaches when you think about food allergies in the school environment. So when you saw the slides, you were probably like, yeah, peanut-free, nut-free school, that's kind of how it goes. And that's what I thought about as well when I first started this project. So those are more considered allergy-free approaches. So they're policies that ban 1 or more allergens in the school environment. And although they have the word free in the title, they absolutely do not guarantee the complete absence of the allergen when hundreds of students are bringing lunch to school every day. On the other hand, we have allergy-aware approaches. So these are policies that support students with allergies through more of like a holistic approach. So there's multiple things that the school's doing. So staff training, emergency preparedness, and overall school-wide education. So another prompt for you to reflect on in the chat: what are the most common allergy practices that you are familiar with in schools, whether for yourself attending school or children or other? It'd just be interesting to put in the chat. And then the last true or false for today: if a school is allergy aware, they cannot have food bans in place. So is that true or false? I'll give you a moment to reflect. So that's actually false. So although the purpose of allergy-aware schools is to create an environment that's educated regarding food allergy safety, they may still have food restrictions if required. It's just different in the sense of schools with just primarily a ban, because schools that are allergy-aware, they're doing so many other things to protect students with food allergies. Okay, that's definitely enough background. So jumping into my actual practicum. So this was done in about 3 stages. So the first was a comprehensive literature review. The second was consultations with school partners. And lastly, my role was to synthesize all of this information and provide Northern Health with recommendations that they can now take and apply to the redevelopment of the resource upon my departure with the team. So the literature review was an academic and gray literature search to understand the current state of the evidence. So we started with a lot of sources and then narrowed it down to about 71 sources, which are included in the review. The majority of those were more scientific studies, traditional research, with about 20% of those being led from Canadian institutions. The other Canadian focus came from the provincial and territorial guidelines, as well as some federal documents. And then I kind of zoned in on that northern BC region by finding 8 school district policies that were available. So what did the literature say? So the literature said that actually nut-free schools actually create a false sense of security. And when we look at retrospective data on anaphylaxis incidents in schools, they do not actually have less anaphylactic reactions than other approaches. And although they allergy bans are typically focused on peanuts and nuts. But if you think back to my first true or false, I shared that peanut and nut allergies only account for about half of the allergies that children may have. So we're really not protecting those other students. So overall, allergy-aware schools that support training, education, management, and prevention with age-appropriate strategies are the best approach for anaphylaxis prevention and treatment. So how do you actually build an allergy-aware school? So when we look back at schools that are like allergy-free or they're just kind of having one food ban, that's one thing they're doing. But an allergy-aware school composes of all of these strategies. So if you look on the screen, there's education, not just for staff and training, but also for students. And there's so many strategies that can be done to minimize the risk of accidental exposure. Having protocols to document, to identify, and to respond to emergencies is also part of this. And then epinephrine storage, use, training, and administration in emergencies, again, is really important. But something that underpins all of this is the clear and consistent communication of policies across the school environment. And you can't do any of this if each individual in the environment doesn't understand their role to play. There's also lots of different considerations when we think about school food policies in general, but when we think about allergies particularly and how they impact students with allergies and students without allergies. And I talked a lot about this in my report, but don't have too much time, so I'm just going to touch on it quickly. But we know that older and younger students require different needs when we think about allergy policies. The literature actually states that with very young children with severe allergies, on top of all those other allergy-aware principles, food restrictions are often necessary because they just can't follow the same rules and prevention activities to minimize risk. Whereas with older students, food bans are really hard because they don't actually follow them. So working to educate and empower individuals with food allergies is a lot better. Bullying. Food allergic students are unfortunately at increased risk for bullying. So schools also need to reflect on how their policies are not excluding students with food allergies. And then restricted choices. So families with food allergies may face additional challenges in securing allergen-free foods. And they also, food allergic students are less likely to participate in school food programs or meal programs. So if schools, if feasible, can work to accommodate students when safe, that communication is really important. But then we have the other side of this and how students without food allergies may be limited in terms of what they can bring to school when there's food bans in place. For example, if we're banning peanuts and nuts, that's taking out a lot of options for families in terms of their choice, selection, and access to bring to school. So the other part of my project was kind of, the literature is awesome and it tells us so much, but really hearing from school partners themselves added a lot more to this project. So I was able to consult with over 10 individuals, so principals, teachers, parents, people with multiple roles, to just ask them these questions and just hear from them, like what's going on in the school environment. So that conversation was very rich, and everybody had a lot to say. So overall, there was just a lot of confusion about current policies. All the individuals I spoke to actually come from peanut or nut-free schools. So thinking, they just expressed some frustration on just, every year on the newsletter, it just kind of says no nuts, no peanuts, and that's kind of the end of the story. And they're actually not aware of anything else that's happening in the school environment to protect individuals with food allergies. There's also, quite concerningly, a lot of the school staff I actually spoke to didn't even know who had food allergies in the school. So there's clearly a lack of communication there. Also, schools are an educational environment, and collaborating with parents, they can also, there's also an opportunity for schools to serve to educate staff and training, but also individuals with food allergies and helping to empower them to be safe in the real world where there aren't necessarily going to be food bans. There was also a lot of conversation about some tension and lack of openness for these conversations. I mean, all the individuals I spoke to were very open to kind of listening to the evidence, but just in general, they expressed that there's just kind of some hesitation and concern with changing approaches that have been the status quo for many years. And then we also talked about just exclusion and stigma for students with food allergies, and maybe just kind of their experiences and really just the desire for food allergy policies to be inclusive and also just clear and consistent across the school as much as possible. So ultimately, This is just kind of a snapshot of some of the recommendations I provided for Northern Health. And really, I think the main recommendation is that this topic is complex and it's a lot to consider for schools, and they also have so many competing responsibilities. So how can this resource be clear, provide definitions, provide practical tips, do's and don'ts, practical strategies that can be implemented at the individual, classroom, and school level, but also provide like reflection prompts on what school administrators can consider when they're implementing policies, and maybe some FAQ to bust some common myths. But really, overall, my goal is that I provide Northern Health with the foundation that they need to now move one step forward in terms of redeveloping their resource and probably actually creating more of a toolkit that can support schools in this topic. And before I close off, I just want to thank everyone involved in my practicum, particularly Amelia and the entire population health team at Northern Health for really guiding this project, the Public Health Agency of Canada for funding this work, the University of Victoria, specifically Professor Margaret Skaya, for supporting and kind of shaping my reports and giving so much feedback along the way, as well as the school's librarian, Dr. Zara Premji, who supported helping me narrow down the sources for the literature review, and also the school partners who shared their experiences and perspectives because they added so much value to this project. So thank you all, and I'd welcome any questions, and I look forward to hearing all of your presentations.